Hi everybody, this is Dr. Dan at Harrisburg Joint and Muscle, and tonight I just wanted to cover some common ankle injuries that we see, and also some of the treatments that we can also do here in office for them, and then also some tips for at-home care if you're dealing with one of these conditions right now. I am not wearing a mask, and you will see somebody's feet in this, so I figured it would pay to show that this is Dr. Rochelle, and she is in fact my wife. So we are all good on the mask front. She actually is wearing a mask just in case. So, with the ankle and the foot, it's a very complex area, right? There's tons of joints and bones in this area, in the ankle and in the foot. And so nothing is as simple as a one joint issue when it comes to things like, and the two things that we're going to cover today are rolled ankles as well as plantar fasciitis, which is in the bottom of the foot, and we'll get to that in a second. These two conditions, rolled ankles and plantar fasciitis, are very common. I do have another job. I also work at Amazon right now. And I hear of coworkers a lot having issues with plantar fasciitis. People that are on their feet are generally really good candidates to have plantar fasciitis. And that normally occurs and shows up as pain in the bottom of the foot. And it can sometimes be general. It can sometimes be pinpoint. Like I said, we'll get into that in a minute. I'm kind of getting ahead of myself. So in terms of the ankle, when you roll your ankle, it's most common to roll your ankle outward, and I will show that here in a second. So it's less common for you to roll your ankle inward like this. It's most common, basically, if you can imagine, like stubbing this toe, and then your ankle rolls out and over top of it. That's the most common direction, which means that all these tendons that are in this area and then the ligaments in here are all going to be strained, right? Because you have a lot of different bones that are all articulating here. And what happens is, as this stretches, so do those tendons. And then what ends up happening is you get inflammation. You can also get micro tears in the muscles, the tendons, the ligaments. And then that can also lead to scar tissue formation. So that's not what we want. We do not want scar tissue formation, because basically what happens, if you can imagine, scar tissue is sort of like cold patch on a road. Cold patch is put there during the winter in a pothole to try to mitigate the damage to the surrounding concrete. But then come summertime, the idea is that, PennDOT will come along and it'll actually fill in that hole again with actual concrete and fix it more permanently. But the thing is, in this case, the body loves to lay down scar tissue. So again, like that cold patch concept. And then a lot of times it's almost like the body forgets to come back and remodel it. So what ends up happening is you get little bumps on the tendons, ligaments, and muscles, and they are not the correct tissue for that area. They're actually just kind of a mismatch of tissue, kind of laying at angles like this against each other, as opposed to the fibers that should be there, which all should be running in the same direction. So we can help to cut down on that, and we can actually also help the scar tissue to be remodeled through some of our treatments. So the main thing, again, is getting rid of inflammation and scar tissue. That's first and foremost what we're worried about. Some people ask me, is it ever too soon to get into a chiropractor after having a rolled ankle? And the answer is no. Immediately is actually a really great time to get in, because we can get ahead of it. We can actually milk the joints. So that means actually distracting, pulling on the joints. And that basically opens and closes those joint spaces as we pull and relax. And that's actually actively trying to get that inflammation out of that area and try to make it less sore for you. So I will show two different things that we do here in office. One, I'll just sort of demonstrate, because Dr. Rochelle doesn't really need any muscle work at this point. And then I will show the adjustment that we perform on the ankle. So the two joints that are commonly affected are the joint right here. So if you can imagine, if you start to kind of push up on your ankle, you can see where those creases form. There's a joint right underneath here. And then the other joint is right back here where I'm pinching my fingers. So this joint here is really commonly affected by rolling your ankle, because you are stretching the tendons and ligaments that come through this portion of the foot right here. And then this one here is less commonly affected by rolling your ankle, but what can happen is you can actually have some tightness in the gastrocnemius, which is the muscle in your calf here. And you can also have some tightness, and in some cases you can actually get some irritation of the Achilles tendon, which everybody's familiar with, that runs through here. And when that muscle is tight and this tendon is inflamed, it pulls up on this joint and then causes compression on basically the cushion that's in that joint there. So what we can do is we can actually just come in and actually pull on the ankle itself. So we do that by basically turning the ankle up into neutral like you were standing on it, and then we just add a little bit of distraction. So sometimes whenever it's in its initial stages, I'll actually just go through that motion. I'll just keep repeating. So I'll distract and relax and distract and relax. And Dr. Rochelle, do you feel that opening and closing the joint spaces there?
Yep.
Yep. So what that acts to do is push out the inflammation. Now, as everything progresses, depending on how stable the ankle is, at some point we will decide to adjust it. So that's what this will look like. So basically I'm going to add that distraction, and then basically I just add a little pull, and then you hear that joint actually pop a little bit. You might not have heard that in the audio, but there was a little pop in there. And then, how does that feel, Dr. Rochelle?
Great.
Yeah. So normally after a rolled ankle, I've rolled my left ankle about 1,000 times, it feels like. And normally after I roll my ankle, that feels fantastic the day of. But in some cases, if it's really inflamed, we'll just work in kind of a passive way. So just kind of milking that joint, pushing the inflammation in and out. The other thing that we can do is we can also use either our fingers, or I really like using the Graston tools, or in this case, this is actually just a myofascial release tool. But what we can do is we can come in and we can work directly on the tendons and ligaments in this area. So basically I would come in with the mullion on, so I'm just going to kind of show you what it would look like. And I'd basically turn the foot out, and then I'd just slowly be scraping. And scraping is not really a good word for it because it doesn't really feel like scraping. It feels more like an abrasion of the area more than anything. And basically what I'm trying to do there is I'm also trying to work out the inflammation still, but I'm also trying to make sure that all these little tendons, ligaments, everything are also not going to get scar tissue forming on them. And if they are, ideally, this tool is actually going to, with the motion that I'm adding in there where I'm stretching that area out, it's ideally going to pull that scar tissue again, kind of from this sort of arrangement into that parallel arrangement like that. So it's going to be a more solid tissue that's there. So I also will commonly work up into this area here. So this is where some of the muscle bellies are for the tendons that come down here behind the ankle. So again, we'd just be scraping up through here, and I'd be adding in that motion to get some tension on that muscle. So we're stretching it out as we're doing that. And that helps a lot. The next thing I guess we can break into is some tips for at-home care. So with a rolled ankle, if anybody has ever had that happen before, you know the age-old wisdom is to put ice on it and then also to elevate, and that is key. Because elevation helps all of that inflammation come back out of the joint, and then hopefully your body can drain it then through the lymphatic system back up your legs. It is tough because the ankle is so far from the heart and from the circulatory system. So basically what's happening is whenever you elevate your foot, gravity is assisting in pulling all of that lymphatic drainage back up your leg. Okay, so I think I covered everything for the rolled ankle. Okay. So then the next thing that I wanted to cover too is the plantar fasciitis. So the bottom of the foot is where the plantar fascia lives. So the plantar fascia is basically what all the muscles attach to across the bottom of the foot that attach and actually, pull the toes down, help you to kind of flex your foot right like that. It also adds a lot of structure to the foot, so it helps with your arches as well. So what happens in the case of plantar fasciitis is that broad tendon has a fascia that lays over top of it, which again, I think I covered in another video, but the fascia is basically like a very sticky membrane that lays over that, and it covers everything and keeps everything kind of in place. When the plantar fascia pinches or kind of gets bunched up, it's again sticky, so it kind of bunches up and sticks to itself. So we need to break that up. We need to make sure that again gets stretched out flat again and isn't all bunched up. And so a lot of times with plantar fasciitis, you see that people's feet start to go from looking like this, like a normal foot, and they start to curl. So you'll start to get actually like a concave kind of effect to the bottom of the foot. So what we do in this situation is we again take the Graston tool, and I treat a lot of this. I've had actually my very first patient ever, whenever I came out into clinical practice, was actually a plantar fasciitis patient. And I had the same reaction that I've had most times, which anytime that I talk about the ankle or the foot, people go, do you treat that? And of course we do. Any place that there's muscle, fascia, ligaments, tendons, joints, we treat that. So what I would do in the case of plantar fasciitis is we start with the foot in a shortened position, so something like this, and then I would basically be opening the foot up, and I'm taking the tool and I'm slowly scraping out that plantar fascia, okay? So People also ask, is it painful? Typically, it's not. We try and I try. I don't take the foot into any range of motion where it's going to be painful, because right away as you work through the plantar fascia, through the tool and through my hands, I can start to feel all the little bumps where there's the little adhesions from the fascia. And basically, I'm just going to get to a point that I can feel them, so I'm not stretching that really taut. I'm basically just getting to a point where I can feel them, and then I'm scraping those out and breaking them up. And it's pretty cool because you can feel them break up over the course of just one treatment. As far as, another thing that people ask is it ticklish? And we have a couple of methods to deal with that. I've had a few people with plantar fasciitis that have been extremely ticklish in the feet, so I've seen that as well. The biggest thing is I actually add a little trick into it. So if you actually squeeze on the toes just a little bit, that actually cuts down on how ticklish it is here on the bottom of the foot. So that typically works, and I normally don't have any trouble with that. Also, the tool isn't a very ticklish feeling. It's, again, more of like a scraping feeling. So that also helps as well. With plantar fasciitis, if you have that now, one big tip for at home, besides just kind of stretching out the bottom of the foot as much as you can, stretching your toes and everything, one thing that I tell everybody to do, and it seems to help a lot, is get a bottle of water, right? And basically freeze that bottle of water. So fill it to the top, freeze it. I like Gatorade bottles for that, because if you can picture a Gatorade bottle kind of has those, I guess they're supposed to be ergonomic little ridges that are around the part that you hold. Those ridges really help, because if you think about like foam rollers and all that kind of stuff, to get a more aggressive foam roller, they always have those ridges and bumps on them. In the case of the foot, that really helps out. So whenever you freeze it, you basically just take off your shoes and socks, and you would sit there and you just roll your foot, that plantar fascia area, back and forth on it. And at the same time, you want to pull your toes up, and so you want to stretch that area out, and then roll the foot over the bottle. So that'll really help too. Most people say that really helps at home in between treatments and everything. So I've always recommended that, and that seems to really help. Real briefly, I just wanted to point out as well, some other things that we see. It doesn't have to be rolled ankles. It doesn't have to be plantar fasciitis. It would take me probably 2 hours to even get close to scraping the surface of the foot and ankle and the things that we've seen. There are other conditions that can cause pain. One really simple one is actually the toes can cause a lot of pain. I've had people come in who have had pain basically from the ankle mortise joint here running down through the foot and then out through one of their toes. And it's amazing because a lot of times just a simple toe adjustment will help. And so all that looks like is basically just pulling down on the toe and then just giving it a little pull, and it pops. And then normally that'll actually relieve it. In a lot of cases, that's just inflammation in just one of the joints of the toe. And it can be really painful. Whenever you're walking on it, you can feel pain shooting down the foot. That's another one. And then we also adjust all the small bones of the foot. So you have your tarsals and your metatarsals. We can adjust all of those, and we have different methods of doing that. And I think that should cover those joints. Now, I do always want to stress it does pay to get a really good diagnosis of the foot. Just like I said, the area of the foot and the ankle are very, very complicated, and they are filled with different areas that can cause the pain to mimic other conditions. So like for instance, if you have that pain going down through the foot, it's good to get checked out, because there are conditions such as Morton's neuroma, which is basically an inflamed nodule on a nerve that normally exists somewhere in the middle of the foot here. And that'll cause a lot of pain if you're walking on it, and especially if you get any squeezing on your foot, like in tight shoes, you'll feel it even more then. And that's a little bit more complicated, and that's something that takes a diagnosis to deal with. So it's not just as easy as saying, if you have these symptoms, this is the condition that you have, this is how we fix it. We really have to get a look at it and see what's going on and get our diagnosis. So again, diagnosis is key to getting relief as quickly as possible. So with that, I think we're all set here. As always, you can check us out on Facebook, or you can send us messages on Facebook. If you have any questions, if you're viewing this video down the road, put a comment on it. We'll try to pay attention to that and get any questions answered. And if you think that we would be able to help you, just give us a call at Harrisburg Joint and Muscle. Our number is 717-999-4347. And I almost forgot our number. That's how bad it is tonight. And other than that, I hope you guys have a great evening and have a great Tuesday. Bye.